I am joined today by our guest, Dr. Warren-Mears. I still messed up. Dr. Warren-Mears. Welcome to the podcast.
Great. Thanks, Dr. Huntley. And please do call me Victoria.
Okay, great. Well, then call me Charlotte, please. It is really wonderful to speak with you, and I have so many questions and such good stuff to lead us in the conversation today. Why don't we start with you just telling us a little bit about yourself?
Sure. I'm Victoria Warren-Mears. I'm the director at the Northwest Tribal Epidemiology Center, which is at a tribal organization that's called the Northwest Portland Area Indian Health Board. It's an organization that's been around since 1972, and it's owned and operated by the 43 federally recognized tribes in the states of Idaho, Oregon, and Washington. And so we serve those nations directly. And so I've been here about 16 years now. I'm actually professionally trained as a registered dietitian nutritionist and got my start doing public health through that career pathway, and then have gradually worked my way to the epicenter. And it's been my real honor and privilege to serve the tribes in the Northwest for the past 16 plus years.
Oh, it's amazing. We have so much to dive into. That's incredible, especially I feel like in today's time, you don't really hear of these long, you know, 15, 16, 20 years. So there's a lot of stories to share and a lot of knowledge and a lot of experience and wisdom. So thank you for joining me to share some of that. I'd love to. I would definitely want to talk about what you do now, but I like to kind of take a view backwards, sort of the pathway to where you are now. So I'd love to dive in a little bit and learn a little bit more about your journey. So when did you first learn about public health or become interested in public health as a career?
Yeah, that's a really interesting question. I was glad to have an opportunity to reflect on that, actually. I don't know that I landed on public health in a very natural way that you would just say, oh, this, I knew about it. I would say I didn't know about it in high school for sure. When I was in college, I actually originally started out to become a pharmacist for a variety of reasons. I got way into that program and decided I didn't like it so much. And so I actually changed my junior year, and I was like, how can I take the classes and the skills that I've developed for pharmacy, and what professions might be open to me? And so nutrition and dietetics was one of them that came up. And so I essentially did all of the nutrition classes that were available to me in about a year and a half. So I didn't lose much time, which was nice. And I'm sure my parents were thrilled that I didn't have to go for another few more years. But when I got done with that, I thought, wow, I don't really know as much about this as I want to. So I decided to stay on to get my master's degree. And so I was at a land grant university at that time. And so there was a lot of emphasis on the cooperative extension field, adult education, and continuing education. So that was sort of my first dip into what would be public health, called public health. So when I finished my program at the university I was at the time, I ended up doing a internship experience, which was part of the requirements to be a dietitian. And I did that at what was then the Washington Department of Social and Health Services in Washington State. And so that now is the Washington Department of Social Services and Washington Department of Health. So you can see that that was kind of when I got really into public health. And so during my internship, I did a lot of public health experiences, everything from surveying facilities to working, with the WIC program. So a lot of different experiences at that time. And when I finished my internship, I had 4 different jobs just to make things really crazy. At one point in time, I was the WIC nutritionist for the county where I was living. I was also working at a hospital doing outpatient services. So again, a little bit more towards ambulatory care, kind of public healthy. And another thing I was doing at that time, which was very early into this, was I was working as a nutritionist for the Olympia AIDS Task Force. And so this was at the very beginning of the AIDS epidemic, and was able to really work with the community, did a lot of home visiting, and set up a program there. So I got my feet into public health kind of serendipitously almost, and really enjoyed having the opportunity to work with individuals in the community. So part of my jam is working with free living people as opposed to people in the hospital, although I've done that as well. But really looking at providing service to the community. So that was how I got into public health. And then um, I actually worked at the local health jurisdiction for 10 years. So I have a little bit of that history of being a long term employee where I land.
Yeah.
And that was the longest I had worked anywhere, actually, was 10 years. And I was like, wow, this is so long. Um, but when I did that, it was just when some of the early work on services for public health were coming up for counties. And I had an opportunity to sit at the table with various people, the environmental health program, the epidemiologists, the social services programs. And I just felt like I needed to have a role in preparing dietitians to sit at the public health table. Because
Mm.
the only place we really were at that time was in the WIC program and maybe a little bit with children with special health care needs. So there was a strong emphasis in public health nursing, which is great as a profession as well. But I didn't feel people were as prepared. And certainly the dietitians I was hiring for the WIC program, most of them had a more heavy clinical orientation. So I thought my being in the world at that point was to go back and work on my doctoral degree and teach people how to be public health nutritionists. And I did do that for a little while, but then eventually ended up back here working at a more not for profit organization, a tribal organization. And so I did the education thing for a little bit, and then this position just really called to me, and I came and accepted it. So obviously, it's been a really great place to be since I've been here for 16 years.
Yeah, that's incredible. Um, I love your story. I love your journey. It's interesting how we can look back retrospectively and connect the dots and find the trail, when we're in the middle while we're going through, it doesn't quite look as clear.
No, it never does. And, for me, being, I didn't ever want to be a specialist in any area of nutrition. I wanted to be like this generalist. So I got to do a little bit of everything. And fortunately, that turned out to be a good career path for me. I mean, some people know, like they really want to work with people living with diabetes, or they really
Mm.
want to work in a level one trauma center or something like that. So they really know that that's their passion. But I really enjoyed all aspects of my profession. And so consequently, I've just had this really interesting career that hasn't been a very straight path. But the one thing that I think has been in common for me, which is something that sort of tugged at me when I was a very little girl, actually, was trying to be of service and help various populations. I always was a helper, and really felt called to help. When I was growing up, we had family friends that did a lot of work with work release prisoners. And so I spent a lot of my childhood around people that were really trying to change up their life and improve their life situation. And so I really just felt called to be a helper. And so for me, that's meant that have ended up here in public health. Other people may end up doing something completely different, but it really has been the place that has given me the opportunity to be with community, and also at different times in community. And so both of those things were really important to me. And so I can trace it all the way back to those very earliest experiences in my life and that desire really to help others.
Yeah. That's important to, and I love how, hearing you articulate that, because I think if a lot of us were to go back and really think about how we were as, a young girl or a young boy, and how, what were our tendencies, where do we feel like we were drawn to, to be the helper, or how, because we're all givers and we have that heart in public health. So
Right.
like where do we see that in our childhood? That'd be interesting to just kind of hear from people and thinking about that. Um, you mentioned the opportunity when you arrived at the Tribal Epidemiology Center. Uh, did you come in as director, or did you come in as a different position, and then work your way into this role?
Yeah, actually, I came into this role. The epicenter was much smaller when I joined the board. We've been thinking about how many staff we had back then, and nobody's actually come up with the right answer or even a good answer yet. But currently, we have at the board as a whole, which is beyond just what the epicenter is, but we have about 110-ish people, something around there right now. And so when I came in, primarily we had a grant from Indian Health Service for the epicenter. We had some funding from the National Institutes of Health, specifically the National Cancer Institute, to do some work around cancer navigators, and then some long-standing programs that had been at the board for a longer period of time, and that included some HIV and STI prevention, diabetes work, so a smattering of different areas, along with the other policy and advocacy work, which is the foundation for our organization. But during the time I've been here, we've had an opportunity to really grow the epicenter. And so my job has been to look at our strategic plan, the wishes of tribal leaders, and then work on getting the right staff and the right grants in so that we can support those needs of the tribes. And so, I've really had an opportunity to grow the program. And so that's been the thing that has been really wonderful for me. And in fact, now the epicenter, our organization, has gotten so large, we're sort of breaking the party apart, I guess, if you want to say that, and right sizing the different entities. So we'll have a clinical support services arm. We'll also have an environmental public health arm. We have the epicenter, which is now going to be the epidemiology and research center. And then we have some other plans to break off some of the other areas of expertise so we can streamline what we're doing and then better serve our tribal leaders, for sure.
Nice. It sounds really, it's important that we, as any organization, review what's working. And sometimes we need to pivot and change. What worked, 5 years ago may not be the best structure for where we are right now.
Absolutely.
So it's really important to see. Um, so that's incredible. So of course, a lot of change, even in your role over the years. Um, could you take some time and describe the population that you serve, and even some of the primary health problems that you target specifically there?
Yeah, absolutely. I'd be happy to do that. So, as I mentioned, the Northwest Tribal Epicenter serves the tribes in the three-state region. There are 12 epicenters throughout the United States, which your listeners might already know, but they basically correspond to Indian Health Service areas. And so we each have a population that's close to equal that we're trying to serve. There's also an Urban Indian Health Institute, which you may have spoken to people from before. And that is their program is an epicenter, but it's aimed at serving the urban Indian programs. All of which is to say that our program specifically serves the tribal nations in our area, so the federally recognized tribes. Now, we do sometimes get out of our lane a little bit, and that is with some of our states ask us to do some of the urban work. This is particularly true for the state of Oregon, where the tribes have specifically asked us to also work with the urban programs. But we do all try to stay in our lanes pretty well, so we're clear about who we're serving. Um, so again, we have tribes in the Pacific Northwest that range from very small to very large. Nothing as large as, say, the Navajo Nation or the Cherokee Nation. But we do have some of our smaller tribes may have just over 100 members. And then, that can range then up to several thousands of members. And so there's a variety of sizes and capacities for those tribes. The way we serve them, though, is very independent of size. We try to provide, equity of services regardless of the size of the tribe, and then really stand in spaces where tribes request us to stand in. So I think in terms of some of the key health issues that we're seeing right now, as with everywhere in the United States, really, substance use disorder is a big concern for our tribal leaders. And we are planning with our behavioral health group here at the board a summit in the month of August. There'll be a national summit to draw together tribal leaders to talk about issues around fentanyl and opioids specifically, and look at some models for enhancing the treatment. The role of the epicenter in that will be again presenting some of our regional data, and we do have that available on our website for sure. Otherwise, I think the pandemic has taken a large toll on mental health for people as well. So again, another behavioral health need, and we've really built that section of our organization out over the past 2 years, really. And so we're doing much more work in that area. In terms of other health conditions, COVID really rose to a high position for our communities in terms of causes of death in the past 2 years, which is unfortunate, but is reflective of some of the social determinants of health and the structures in community. So that has been and continues to be a large issue for us. Otherwise, if you just take COVID out of the equation, which I'm sure all of us would love to be able to do, we could just put it aside for a while. Um, if you look at other health issues, then there's, diabetes, cancer, heart disease, cardiovascular disease. And then among the younger population, there's a lot of inequities around accidental death. And so, like motor vehicle collisions, work related injuries, and then other unintentional injuries. And so, that really is a more pronounced problem in some of the younger population as well.
Mhm.
So, I guess the needs are similar yet somewhat different than the general population. When you look at the data, it looks fairly similar. Um, but we do have some of those uniquenesses in terms of like the unintentional injury area. And then definitely, I think the substance use disorder and the mental health issues, I think, are problems across the United States right now after the pandemic, but um, are really topics that our tribal leaders are wanting us to address right now.
I see. Hmm. And that is, thank you also for clarifying and mentioning the Urban Indian Health Institute, because I was actually going to ask you about that with it being such a close neighbor, the differences in the roles. So I appreciate, that clarity. Um, a lot of important work, a lot of, I hear consistently across the board with the different texts, speaking to some of the issues, some very similar, I guess,
Absolutely.
disparities across each one. Um,
Yeah, absolutely. And, each of us approach the issues that we tackle based on our constituency. So we have common functions for the epicenters that we're to be providing mostly around data use, data analysis, and recommendations to tribes and urban organizations. The similarities are there, but we all do those in a different way. So we always say if you've seen one epicenter, you've seen one epicenter, because our tribal leaders in each area will ask us to do different things based on the perceived needs of their community. And so that's really one of the most important things we do is, we do some annual surveys of our tribal leaders. And in our case, we try to harmonize those across the board. So we have a policy survey that we do to try to get at their advocacy priorities. And then we also have a health survey that we do to get their most pressing health issues that they'd like us to address. And so the way we approach our work at our epicenter is that we focus on those priority areas, our strategic plan, and then helping to inform the policy initiatives that are going forward and the advocacy work on behalf of the tribes. Because, the data that we're producing and the other research that we're producing really can support those advocacy efforts and really help to mobilize resources to our tribes, which is one of the most important things that we need to support.
yeah. Um, this actually there's kind of two things I want to ask you about, and this is a good segue into both. The first is I was wondering if you could speak to a bit about the trust relationships with, the federal government and the tribes, and maybe, Alaska or Alaska, um, American Indian Alaska Native people.
Yeah, absolutely. And this is such an important foundation that's really different in public health work
Hmm.
with tribal nations. So, as we know, each tribe is a domestic sovereign nation. So, I always liken my job a little bit to working for the World Health Organization on a small scale. So, I have 43 bosses in my area, each of which has an individual vote. But it's really important in the context of the work that we do that we get this information correct. So the federal government does have a trust responsibility, and there's a number of Supreme Court cases that outline this. And actually, if people are interested in reading more about it, Bureau of Indian Affairs and Department of Interior have really excellent resources on their website that go into that responsibility. As when people came and colonization happened and all of the events that led us to where we are now, the tremendous amount of land and resources that were lost by tribal nations were huge. And so there is this federal trust responsibility or moral obligation, is actually how it's termed in the litigation, for the United States to provide for American Indian and Alaska Native people. And so it's it's an immoral imperative to try to, you know, support, I think, the obligations for what was lost by tribal communities over the course of time and westward expansion and all of those things. And so there's a fiduciary responsibility that goes with that. And I could um, spend a lot of time on that, and we could talk tremendously about how that really hasn't come to fruition. But in the Northwest here, we have many of our tribes that had treaties with the federal government as well. And those treaties said that they would cede certain things and land masses in return for things from the federal government. And it's very interesting when you get into looking at the treaties and reading through them to look at how long they took to negotiate, who were the negotiators, and then how long they took to implement. And so, I'll just use one example of a treaty here in Oregon, and it was negotiated. There were government officials who came to negotiate. Um, they did not speak the first language of the tribes. English was not our common language. There was a trade language that was used. So they had essentially some of the traders that had been in the area were the interpreters. So you can imagine that they were speaking a language that was no one's first language, really. It was the language they used to try to communicate with one another. And so when you look at those, if you look at signatures, you always expect like someone's beautiful signature, and you look, and there's a lot of people who sign, that were the interpreters that sign with X's. And that means that they probably were not functionally literate in their first language, which may have been French or English or something else. And then they weren't necessarily, they knew enough of the trade language to be able to conduct trade. But was there a complete understanding in terms of what was being given and then what was to be received from the federal government? A lot of the treaties were negotiated in a very short amount of time and were then, considered executed. They went back to Washington, D.C. by Pony Express. I have no idea how long that takes, but it wasn't instantaneous, clearly. And then when they got back to the Congress, then they had to ratify the treaties. And, there was this expectation that the things that people were promised, which were physicians, farming implements, the land base that they were going to have, all of those things, there was this expectation, most likely, that these things were going to start showing up. And some of those treaties took Congress 6 months to ratify. So you can imagine sort of how you would feel being on the end of this and not getting those items that had been promised to you for giving so much up. So, the trust responsibility goes into that moral imperative to do better than we initially did. And so it's an important concept. The other thing, though, that it does is it gives us this other concept that we need to think about, which is beyond simple race and ethnicity with American Indian, Alaska Native people. It's actually that being an American Indian or Alaska Native person, it's a political status in the United States. So it indicates that you're a member of a domestic sovereign nation, you're a member of the United States, and you're also a member of your state as a sovereign nation. So essentially, tribal citizens are members of three sovereigns. And so when we're talking about race and ethnicity issues, because of this sovereign relationship and government to government responsibility for consultation, when we do analysis for race and ethnicity, it's more than just your race. It has to do with your political status and the government's responsibility from that moral perspective, but more importantly, from the fiduciary perspective as well, for people that fall under this classification.
Yeah. Thank you for sharing that. That's it's very enlightening. Still a little frustrating. But it does help to uh shed some light on some of what we commonly hear, maybe often hear, but not really fully understand when it comes down to the relationship and some of those trust issues. Um, can you just speak a little bit more about this the tribal sovereignty, in general? I love to ask this question. The first few rounds of interviews with the Tribal Epidemiology Centers, I didn't really dive into it too much until I got to data sovereignty kind of issues. But I would love for you to speak to that because I think it helps our audience to start to embrace a bit more understanding.
Sure, absolutely. So, as I mentioned, in the United States, I think currently there is 574 tribes, I believe. Now, I hope I'm right still in April because anything could happen, right? We could get more sovereign nations being recognized, and that would be amazing. But there are these nations that are within the United States and meet the criteria that have been established to be a nation, which basically means, like any other sovereign, you have the authority over your people. And so the way this plays out could be different tribe by tribe, but ultimately tribes are responsible for the health of the people of their nation, and so they have rights. For example, they're public health authorities. So the right of the state to be a public health authority doesn't trump the right of a tribe to be a public health authority. So they function as a domestic sovereign nation with all of the inherent rights. And so, you've already had the discussion about data sovereignty and what that means. Again, there's many interpretations for that. So if you imagine that each of these nations, 43 in our area, have the ability to interpret what that sovereignty means for their people and the kinds of decisions. So you'll find that on tribal lands, there are laws and rules that apply to the citizens there, and they have governments. So when you go and talk to tribal council, you're it's like essentially going in and talking to President Biden. So you go in and you talk to the tribal chair, and that person has the esteem and the authority of the President of the United States for that nation. And so, again, each tribe has a slightly different governmental structure, but those governments are responsible for all aspects of the lives of the people and making the lives as best they can. So I always have to remind myself before I go to tribal council, because I often expect tribal council to be all, up to speed on every health issue or everything related to public health. And the fact of the matter is that the councils are responsible for all aspects. So they're responsible for financial aspects, they're responsible for the business development, education, health, all of the different aspects of their community. So those elected tribal leaders have to become expert in many, many areas. And, we don't all come in with expertise in every area. And so it is a tremendous role that people play, and important in that deliberation of what's best for the health and security of their people. And so it's very important to remember that regardless of where you're sitting, whether you're sitting in an epicenter or you're sitting, in an academic center or someplace else, and you want to work with the tribal nation, you need to treat that the same way you would treat multinational work. And so it isn't, you don't just go in and do whatever you want. You go in and you get the permissions of the leadership to do that. And that can require long negotiation and, development of relationships. So that's a really important piece. So, I think when you're doing work in Indian country, it's good to expect that it takes time to build those essentially international relationships.
Absolutely. Thank you for that. That's really well said. You're great at explaining these concepts and challenges and issues in a way that is, I feel people can really start to grasp and understand on a much deeper level. So,
Thank
really,
you. Yeah, and again, if people are interested in really reading more in depth, because there's lots of information out there, and I'm just, kind of giving the 3,000-foot overview today. I really recommend that you go to the National Congress of American Indians, which is a national organization that does advocacy work on the part of all the tribes, and they have some really nice tools there about tribal sovereignty and how to approach that work. They have a nice policy think tank that talks about how to approach data sovereignty, data sharing. So there's lots of really nice tools out there. And for anyone that's listening, their website is just www.ncai.org. And then you can type in the topic you're interested in reading more about. And it's really an outstanding resource that's available. And I think one that's really supported by the majority of tribal leaders as a place for expert information. So it's kind of the Congress, so to speak, of the American Indian tribes, and it's the organization that pulls people together in that way.
thank you so much for that resource. I was writing that down as you were saying it, and we'll make sure we add it to our show notes too for people that are listening and maybe multitasking, driving, doing other things and can't take notes. We'll have all
Absolutely.
these links in the show notes, but I really appreciate that. This has been so helpful in so many ways. Um, I'd love to connect the dots and really help people develop their own applied, practical understanding and definition of epidemiology. So, with that in mind, in your own words, not flipping through textbook or anything, but just in your own words, can you describe how epidemiology is important in the work that you do in the community that you serve?
Absolutely. I'll try to do it. It is a little nebulous when you think of, if you think of the pure definition of epidemiology, so looking at causes of disease, but it's extremely relevant, I think, because the work that we're doing, which involves a lot of correction of misclassified people in data sets. So we're pulling the group of people together. So we're able to really describe what the challenges and opportunities are for the community with that lens that the American Indian Alaska Native people are a political group. So we don't parse them into small groups based on race and ethnicity. We also are really trying very hard to make it practical. And the practicality is of it is that you have data and you have diseases that happen, but you can put those two together and form a good picture for advocacy. So one thing is to get the data accurate so we know the extent of the issues in the community. But you can't just leave it there, right? That's very unrewarding actually. I sometimes say, I feel like I'm a downer because we're correcting data and it invariably ends up looking worse. And that's no fun.
Right.
But it does give us a baseline where we're working from, and then trying to then support that data and that epidemiology work and to really say, okay, what are the social determinants of health? What are the conditions that are playing into this? And are there places that we can help tribes by providing the data and also providing programmatic support where it's asked for to be able to enhance what's going on in community and ultimately improving people's health? So, I know there's lots more sexy jobs out there than becoming an epidemiologist. Nobody goes, oh, yeah, that's such a cool job. Although during the pandemic, I think we were a whole lot cooler than we were
Right,
before.
right.
Um, but that's all well and good. But the issue is that there's all sorts of choices people make in terms of what they'd like to do for their careers. But, if you really want to dig into data and look at what's happening in community and then really get into sort of some of the strategic interventions that you can help with in your own community or be a support person and advocate as I am for other communities. I think it's just so important to find out if you have that interest in that niche, because it is like sometimes you just think, oh gosh, here we are, we're just pointing out how bad everything is, and um, you know that's not very optimistic, but it does lead to policy actions, it can lead to funding actions, and it can lead to programmatic interventions in the community. So all of those things help tribes to exercise their own sovereign authority and to be able to move their community forward in a good way. And that's one thing in the last 16 years that I can honestly say is I've watched the tribes in the Northwest, and it's so inspirational to me to look and see the changes and progress that have been made in community. And now, our tribal nations are all really working hard on building up their public health expertise. And, that means that we get to do perhaps more challenging epidemiology work and more technical work and supporting them, pulling their own data together. But, we want everyone to work at the top level that they feel that they can do. Then, as an epidemiologist, we're going to step in for some of those smaller tribal nations that may not be able to afford their own analysts. We're going to be available if they need that kind of information. And then hopefully be able to provide any technical assistance to utilize that information for the good of the community.
That's wonderful. Wonderful. Um, I have a very broad audience of listeners,
Mm-hmm.
students, professionals, all different levels, entrepreneurs, people that are just curious about public health, just and everything in between. Do you have any advice for someone who may be listening now and also interested in working with tribal communities?
Well, I have all sorts of advice. Come do it is the first piece of advice because it's super rewarding. If you're exploring it, I think depending on where you're at, but if you're a student, there's certain things you can obviously do that maybe someone who's a professional who's thinking about career switching may not have
Right.
the fluidity to be able to do, as an example. But certainly if you're a member of a tribal community, reach out to your own community and see if there's places that they're doing work in public health, and maybe you can shadow and see if that's something that you find appealing on your own. If you're a student at an academic in an academic program going for a public health degree, awesome, we love that. Explore your internship opportunities. We do a lot of internships. I think all of the tribal epicenters do, some paid, some not paid, but we have data science experiences and then all sorts of other topical experiences too. but explore that as an opportunity. And certainly if you're contemplating a career change, which I think a lot of people do over time, and you're going to go back and maybe be an older student and you really feel like this is a passion of yours, again, get in touch with the tribal community that you'd like to be involved with and develop a relationship with them. And then if you need to reach out and you need experiences, many of the epicenters have some training programs where you could get some skill training. We specifically have a summer institute that we run each summer. This year it's virtual. And we offer courses across the spectrum of public health. And that's for anyone who works with the tribe, works at a tribal epicenter, or is a Native person who is interested in public health. So you can come and get a taste in a shorter time if this is something you're interested in. The most important thing, though, is to take the first step to doing what you think your passion is. And, people will get concerned about, like, well, how do I fund this? How am I going to be able to do this? And I would say that that's a lesser concern. I know that sounds terrible, right? Like, don't worry about money. But in fact, there are many, many scholarships available. And, if you're a tribal citizen, you need to investigate what your own tribe offers. But there are scholarships for Native students and others wanting to go into public health. So you just need to take that risk. And, the other thing is for people that are career switching, there's loan repayment. If you want to go work at a tribe, there's loan repayment for many of those degrees through Indian Health Service. So, I would say don't let that limit you. I mean, dream big and do what you want to do, and, get the experiences you need to make sure that's what your passion is going to be, because you want to be in a job you want to do, right? Nobody wants to
Right.
do something they're not passionate about. But really explore it and see if it fits for you. And then if it does, then you can explore, like, okay, how am I going to fund this? Because you probably don't want to take out huge amounts of student loans, but there are scholarships. And so just being sure to look at your options and then reaching out to people who are doing what you're doing or what you want to do and ask, how did you get there? How did you do that? How were you able to afford to go to school or whatever? And people are really happy, I think, to lend their expertise. And you also may find a mentor who really can help you walk through the process at each step.
Oh, that's wonderful advice. Such good stuff in there. So, thank you so much, Victoria. I appreciate you taking time and meeting with me, being on this episode and sharing so much wisdom and insights. And just, it's been such a treat for me to visit with you and learn so much more. So I appreciate you sharing this with me and also my audience.
Great. Well, thanks so much. I'm just really honored to be asked, and just feel really blessed to be able to be an advocate for the American Indian Alaska Native people in the Northwest, and just incredibly blessed that I've had the opportunity to serve the tribes for the past 16 years. So, if anyone would like to reach out to me, I'm really happy to talk to anyone about public health and how they could get involved here in the Pacific Northwest.
Oh,